What I'm wishing for you is we're going to look at some of the research, not a lot about it, but some of the research about the substance misuse and the impact regarding parents' need to turn over their parenting role or to have it removed. Learn about the issues generated for grandfamilies and kinship care. And I've been down that road twice through two different types of avenues. We'll share some information regarding resources. And the one thing that I really want to spend a little bit of time on too, because cases nationally have to have a focus of reunification as long as they can. We need to take a look at that and the impact. If you're a kinship care provider, what does that mean to you? So get ready, get focused, grab your coffee if you haven't already. I got mine, and let's go. One of the best resources you'll find for looking at kinship care and grandfamilies is Generations United. This every year they publish a new document with a different focus, and it's very thorough. And every 2 years they update information and factual information on the states. This just came out in September, so I encourage you to go on their site. It's gu.org, Generations United, gu.org. I want to just briefly kind of take a look at what we know about children. And these are the children that we are moving into kinship care and into grandparenting care. 1 in 4 children live in families with a caregiver suffering from SUDS. And at a recent DEC Alliance conference, it was cited that some of the newest, freshest information said at least 1 in 8 children live with SUDS, whereas this says 1 in 4 children. I think that there's a little discrepancy there, but even if it's 1 in 4 children, we need to take a look at that. That's a lot. And if you're in a classroom of 20 children, that means 5 are living with substance use disorder. Children are often the first hurt and last helped, and that's one reason the circle of care has been put into place. We know that there are children out there experiencing great loss, great sense of grief and loss, and people don't know how to handle that. The difference is you can work with children when a child has been left dealing with a parent that died from a heart attack, a car accident, diabetes, cancer, all these things. But when you add the stigma and bias that goes with substance use disorder and mental health disorder, it's a whole different way of looking at managing and helping children through grief, because they feel like it's their fault more so than in natural situations. Children are desperate for support, and it's important that we do that. In the United States, over 8 million children have at least one parent with a substance use disorder. And the thing that I really wanted to bring forward, and this is, oops, it's not on this slide. We'll get to it in a minute then, is it's undercounted. So many children are living with grandparents, and it's not gone through a system, a legal system, where there's any record of it. And it's estimated in Illinois alone, there for every 1 child that has formally gone through the system and been placed in kinship care or with grandparents, there are 10 other children that are out there floating around, maybe going couch to couch, relative to relative, and they aren't being counted, and they most likely aren't being supported. So it's important that we know that. The other thing I wanted to mention is it's estimated that over 320,000 children in the United States lost a parent to a drug overdose between 2011 and 2021. This was just published recently in the JAMA Psychiatry magazine, but it's supported by the National Institute of Health. And looking at this, grandparents or another kinship member are often the people, most likely the people that are taking on the responsibility of these children. So understanding that, and that this is an epidemic in our United States, we've got to be looking more at what are the resources for grandparents. And looking at the highest number of deaths were parents aged 26 to 40. So we're talking about young children. I consider teenagers even young. In families, children who have a caregiver with a substance use disorder, this is what our kinship people are taking over. What the role they're taking over is where these things have happened. They see and hear more fighting. They're likely to witness more crime. We know that they're liable to suffer more poverty, even if there's an income coming in, and it's often going out for the substances rather than the food. Losing more stable relationships with caring adults because children are early taught to don't talk, don't trust, don't feel. We don't talk about it, so other people don't know what's going on. You can't trust anybody because they might take you away from me, and you have to let go of the feelings of safety. If you're a child, I've been there, even in a family that's still together, that feeling of I can't trust, I can't talk, I can't feel, I can't let my feelings come out. And we're talking about what we know now as trauma. And children, especially grieving children, suffer a lot of trauma. And we also know that the research that's come out in the last few years shows that children as young as 2 months are impacted by trauma, especially if they're in this kind of situation where they lay in the crib all day, where they may not be fed, where their diaper isn't changed, etc. That's not something a child just forgets, like we used to think so. Well, they're so young, they won't remember. Yes, they do. Their brain remembers. We know that when kinship becomes a full-time parent, it's due to a lot of reasons. There's child welfare and legal issues. They may be away in the military. The child may have been having social problems and was removed. A lot of parents end up in the Department of Corrections and incarcerated for a while due to substance use. I've had that experience in my family. I have taken a child to visit a parent in the Department of Corrections, or the death of a parent or caregiver. And we know with the opioid disorders and deaths that we're seeing more and more of that. But more often than not, when a child is placed in care of family, there's a correlation between alcohol and drug abuse and the neglect on the part of the parents. Whoops. I think my spacing got off. This comes through the parents raising grandchildren, looking at the legal issues of custody, guardianship, etc. And the records are showing, when you look at the legal issues, that this is true. This comes out of the Grandfamilies Generations United information, where they talk about 2.5 million are children living with grandparents or other kinship care without parents in the home. This talks about one child being raised by kin in foster care. In foster care, there are 19 children being raised by kin outside of foster care. Because sometimes if a child's placed, and the preference, like in Illinois with Department of Children and Family Services, they're going to want to place in the family first before they place them in alternative foster care. So sometimes they're there and you get that support and help with the children. But we know then there are also 19 children compared to the one child that are being raised outside the system. And we have a variety of things that we know are missing, and that's one of the things we're going to talk about. But I'm not going to go through this bottom thing, but we know that being in kinship care is the best place for a child in most circumstances. This was the data on Illinois. It came out in 23. So it was probably based on 22 that in Illinois, children living outside of their parents being the primary caregiver, there was over 260,000 children. And this is where they were saying one in every child raised by kinship in foster care in the system, there are 10 being raised outside. And that's the data for Illinois, which is a little lower than some of the other states. The definition of kinship, I want to keep an eye on my time here, because there's some things I really want to get to for you. Kinship care is when a parent's not present in the household and the child is somehow related to the person providing that care. It could be a grandparent, it could be an aunt, it could be an uncle. In my family, we 2 different times had a granddaughters, and then we had great granddaughter for 5 years. She's now with her dad and bonus mom in a very positive environment. But you look at all these different people that could be there, or if they're listed as a non-relative of the householder, but yet considered a family friend. We have got a couple of friends that I consider family, but they're non-relative, and we would be feel very safe, children being placed in their care. Doesn't happen often, but it does happen. That comes from the Kids Count Data Center. Children with kin are more likely to have better behavioral health outcomes. They stay connected to siblings. Rather, oftentimes when they go to foster care outside of family, the siblings have to be split up. They keep their cultural identity, and that is so important for children that are managing. If they're removed, there's a sense of grief and loss. And if they also are removed from their own cultural identity and any kind of community connections, it's really sad and it's very traumatic. And they're more likely to, quote, exit foster care, kinship care into being a part of a permanent family. If they don't return to their parents, that family member is more likely to adopt. I supervised for a number of years as an outpatient coordinator one of the contracts here in Central Illinois, because we're based out of the Our House, which holds the contract for the resource center, even though we're statewide there in East Central Illinois. And we had the contract between DCFS and what was then DASA. So for 8 years, I worked very closely with that system and learned a lot, the difference between outside foster care and family care, et cetera. Children living with kin are more likely to have all these things that I just mentioned. Kinship care benefits research repeatedly shows that compared to placement in non-kinship settings, that it reduces their trauma of removal from their parents, because most of the time that's going to be somebody they recognize, somebody that may have already been a part of their environment very strong. When we got guardianship of our granddaughters, our daughter, whom we adopted as an infant, but we knew that there was some family biological history, so we kind of ended up going down the road from her biological parents, and they were placed with us. We still have good relationships. They have good relationships with her now, but it was a rough time. We had guardianship of our granddaughters till they were 18. There wasn't near that trauma of removal because they were used to being here. They were here a lot and oftentimes left in our care. So that kinship connection was so important with what was going on in their lives. And it also reduces their chance of being moved from one home to another. And when you talk about kinship care or grandparents raising grandchildren and the placement, I put this in there because I experienced this and the call comes. I was sitting at a desk. I was working for Prevention First. I was in Springfield at my desk and the call comes. We have your grandchildren. We need you to come. I suspected that would happen someday. Matter of fact, I probably really hoped it would for both our daughter and her children. They needed that break. But this is what happens. Fear, sadness, awkwardness, joy, anxiety, calmness, all these things were part of it. And it's a new responsibility, whereas we had been grandparents before and often had the children for 2 or 3 days at a time. It was a whole new level of responsibility. And what happened, this is a newer thing that we're seeing and looking at when we talk about grief and loss and children, is relocation stress syndrome. It wasn't great for our granddaughters, but it is for a lot of other children. It's physical and or psychological. And it means that there's a disturbance from transferring from one place to another, from one home to another. Our granddaughters were here enough that that wasn't traumatic. They felt at home here, which was a blessing. But oftentimes not. Oftentimes grandparents live in a different state, and that has to be a move. And oftentimes that move is just the beginning, and then adjusting and grief are just starting at that point too. Children don't know how to juggle all that, and we have to be there to help them. The other thing that's often, that's why you're looking at the relocation stress syndrome is important. That also happens with older people, seniors, as they get moved from one place to another in appropriate care. Just so you know, it's like children here and our older people here. We can't leave grief out of this, and I've just got one slide that pertains to that, but it's often an experience that's not recognized because we don't think of it as grief. And it's important that we understand the impact that grief has on children when they're removed from their parent. They love their parents. Most children, even though they may be frightened at times, they may be scared, they may feel neglected, there is a loyalty there to parents that sometimes even isn't even understandable to me. And I've been hanging around this field for over 40 years and have had these experiences myself. For grandparents and other kinship people, there's a variety of issues that come up. May not have had any mental or emotional training. I feel very lucky that I have a master's degree in psychology, that I have experience before going through all this. So I had some idea of what was going on and what was going to happen, but it's still very different when you're going through it. You can read about it in a book, you can talk about it with other people, but until you experience it, you don't understand that. Oftentimes there's a lack of financial preparation, a need for diapers, a need for formula. Those things are expensive. I had a great granddaughter that was born 2 years ago, and one of my granddaughters took guardianship of her, in a sense, adopted her, but she wasn't prepared for this. She wasn't prepared for buying huge amounts of diapers, and the formula for this child was $60 a can for the first year. It's a shock. The need for an appropriate car seat for a toddler. Suddenly you're told to pick up a child from the hospital. You're told to come get them under certain circumstances. I didn't have a car seat to pick up my granddaughter. We had to buy them, and buy them fast. There's a lack of cribs or children's bunk beds. And you gain a child with health and medical concerns oftentimes because they don't get the health care that they need prior to being placed with you, or prior to you stepping in and saying, I will take this role. Oops. Well, where are we going here? There we go. Housing's a big thing, oftentimes, especially for seniors. Since you don't have any warning or preparation, we couldn't even stay in our home, even though our grandchildren had stayed here and had beds here. We were not allowed to bring them home. We had to find another place to stay for 2 days until they could make sure everything was where they wanted it as they placed them with us, which I thought was very interesting. But I also think they thought that the parent might show up and create some chaos, and they wanted to make sure that transition was good. With grandparents, they oftentimes have difficulty accommodating children, especially if you're in a senior center. The residents may be too small. You may be living in a housing that excludes children. What do you do? How do you take care of that? You're unable to relocate due to affordability. And children oftentimes will violate a lease agreement. Some residents may have safety hazards. If caregivers have disabilities, relocation may be an issue, because if you're where you can get around and you suddenly bring a child into it and have to move, it's not easy to accommodate all that. Residents may not accommodate children with a disability. So where do you go with that? and relocation may be an issue regarding school enrollment. Okay, let's take a look at health. The stress of caring for children can be overwhelming. Many children suffer from several physical or emotional or behavior problems, a lot of trauma. We experienced that not with our great-granddaughter when we had her, because we got her as an infant and she pretty much had lived here from birth. But we did see it in our grandchildren because they were older when they were removed. And we had some behavioral problems. We spent a lot of time going to doctors and trying to find ways to take care of that. One came through it beautifully. The other still struggles with some behavioral issues related to, I'm sure, the trauma that took place. Contributing factors are a lot of things: prenatal drug or alcohol exposure, infants born that had exposure to substances prenatally can have all kinds of issues, or they can come through, and if the caregiver has the right training or the right experience, they can walk them through those things that happen. But oftentimes grandparents just don't understand that. Us seniors don't always know what to do, don't understand it. You have to get more training, and even younger people. There could have been sexual or physical abuse that these children are coming in with, which means that all of them, especially the prenatal babies too, it's harder for them to get that attachment and generate that attachment. And living with that and taking care of children that struggle with attachment is a problem. Feelings of abandonment. Of course, they're going to feel abandoned. Their parents have had behavior to a point where they've been removed and placed somewhere else. It's not easy. They may feel safe where they are, but there's still going to be that feeling of loss. And then again, the relocation stress syndrome. Grandparents must apply for medical services and public assistance. I'm going to take you through some resources and some, if you go online to illinois.gov and you go into grandparents raising grandchildren, the DCFS sites and things, a lot of this will come up, but there is a quiz in there. And I would love to, when I do this in person, we actually take the quiz, but I'm going to give you the information that comes from that. Documents listed below. Grandparents must provide in order to acquire most services or gain access to vital records. And that question mark shouldn't be there. You need a birth certificate. You need proof of citizenship. And these usually become one, but if they come from out of country, if you have families that the birth certificate is not from the United States, you need to have some kind of proof of citizenship. You need a Social Security card and medical records or proof of immunization. Now, to get these, it's not always easy, but to have access to some of the most vital records is important. Many grandparents raise their children without seeking or being granted custodial rights. As we said, there are 10 children for every one that's formally in the system, 10 children that aren't. So they don't have custodial rights, but the children happen to be there. The one thing that's important to know, it's not necessary for the grandparent to have guardianship in order to obtain a Social Security card for the grandchild, but it means that you may need some of those other documents. And look on the Social Security site and see what you need. It is necessary for grandparent to have guardianship in order to obtain a birth certificate for the grandchild. Been there, tried to do that. When we just had when we first got our granddaughters, since it was through the Department of Children and Family Services, the first 6 months we were foster parents, and then we were given custody and guardianship. But when I needed birth certificates for the grandchildren, I had to go through the Department of Children and Family Services to get that, because I didn't have proof of guardianship in order to obtain the birth certificate. Grandparents must often apply for, oops, I don't know why this is jumping around. I apologize. Legal, many relatives provide care for their children without legal custody or guardianship. 10 for everyone that has legal custody or guardianship. Litigation is costly, very much so. We took on guardianship of our great-granddaughter, and it was costly. We helped pay for the adoption of our other great-granddaughter, and we're talking about thousands of dollars. I'm lucky to still be working. We're lucky to have that kind of income to be able to help that happen. But for many people, it doesn't, and they're out there floating around, not having access or not knowing how to get that legal custody or guardianship, or not wanting to go to the right people because they're afraid they might be removed. Many relatives do not pursue custody or guardianship for the financial reasons, or afraid that if the parents still have that right to their children, even though they may not be doing a very good job of parenting and have left them with grandma, grandpa, or aunt or uncle, they're afraid that if they make that step to get legal custody or guardianship, the parents will take the children and they won't see them again. And it happens, folks. I learned that in my work. Luckily, we haven't had that here. For many grandparents raising grandchildren, one of the most difficult challenges involves dealing with social service agencies and researching programs. There's a state program offering financial assistance, and I didn't know that until we were kind of into our great-grandchild. Not that we needed the income, but I didn't know that there was what's called child-only TANF. And that is an opportunity to get some income for the child without counting the grandparents or caregivers' income. It's just the child's income, which is zero, which qualifies them. Also, we need to know grandparents don't have to have legal custody in order to get Medicaid for their grandchildren. Again, it depends on the circumstances. Grandparent does not have to receive Medicaid assistance in order for the grandchild to get assistance. We had our own insurance with both times that we've had grandchildren and great-grandchildren in our home. Grandparents can apply for Women, Infants, and Children's Services, the WIC services. There is some consideration of income, but a lot of them don't even think to apply unless they come through the Department of Children and Family Services system. It may be possible. Children who are eligible for TANF are automatically eligible for Medicaid healthcare assistance. So if you have a child that you have in your care that qualifies for child-only TANF, no matter what your income is, they qualify for Medicaid. And this is just a little bit more of an explanation of that. If it's a small grant for each month, this is true clear across the United States. If I had the chart, if I had time and I put the chart in, it gives a lot of different levels in states. Illinois gives one of the smallest children-only TANF grants. Ours was just $200 and some a month, but it all helped, and it helped to get her extra things that she needed. Qualified her for medical assistance because we were on Medicare, which they don't qualify for. It also would have paid, even though I worked full-time, we didn't access this, but it will help qualify many caregivers, daycare assistance in the cost. And if children are receiving the child-only TANF, they can have it until they're 18. There are family advocacy centers across Illinois. There's 30 of them. And DCFS Office for Children and Families works as a liaison for DCFS along with the Department of Aging, because when you are, if it's over 55, you can get information and sometimes some help through the Department of Aging, not financial help, but other types of help. And there's 30 of those avenues. If you're out there, if you're working with families that need to be aware of these resources. There's an extended family support program. Matter of fact, I'm on a task force committee for them. It's provides information. It doesn't give you money on a regular basis, but it might help you either save you some legal costs to get information on how to go about getting custody and guardianship. It will help you find the resources that you need. You only have to have had a child for just more than 14 days in your care, and you get their help, their services, and they can lead you to the other parts of state organizations and agencies that can help provide that care. That's what they're there. They're the family support program. But you call the DCFS hotline, but what you say is, I'm caring for my relative's child. I've been caring for them for more than 14 days. The child is not being abused, not neglected, but I need help. And you want a reference to the extended family support program. I will go back and mention that when you apply for a child-only grant, we had guardianship of our great-granddaughter, but we still had to have a witness sign a form that says that child has been in our care. They just want to know that that child has been in your care. And it was kind of interesting because we already had custody. The Department of Aging has grandparents and other relatives raising grandchildren program. And if you go on the website, you'll see lots of information around this. What it does, it's different in different places. These are usually grant funded programs that go out to senior centers of some kind. We have one locally here at the Lifespan, which is a wonderful organization and provides lots of services for seniors and up. I talked with them when I found out that that person was there and that this was going on. And we were given some help with moving through the guardianship process. We were given a couple $100 assistance in that. So it depends on how the funding is that year. But on a regular basis, they usually provide support groups. They can help with individual counseling. They can do caregiver trainings. The different organizations that get these funding and these grants may do different things. They may do some kind of help with finding respite care if you need a break. And let me tell you, sometimes us older folks need a break. It's just a great resource to know is there. And I can't believe all the years that I didn't realize they were there. There's different kinds of supplemental services on a limited basis to complement care provided by caregivers, through grandparents raising grandchildren, through the other types of, if you go back to the extended family support program, it's getting a hold of them. It's knowing that they're there. And the local area agency on aging coordinates services and programs for older caregivers across Illinois. Go on their website, take a look at that. There's a lot of different things, and it differs according to where you are in the state. Children not in physical custody by a parent or guardian are considered unaccompanied youth and have a right to attend school under the McKinney-Vento Act. We had some trouble getting our kids into school, even though that would have been back when we were still in the foster care phase of having our grandchildren. This wasn't in place at that time. But grandparents whose grandchildren have just been left there, or kinship care, they've been left there, there's nothing formal. You don't have the paperwork that says, yes, you're the guardian, or you have been given custody of that child with you. They still have a right to school, and every school will have a representative to deal with the federal law around the McKinney-Vento Act, be aware. I didn't know that. When children come into the household, grandparents and kinship caregivers, you put your own needs aside. This is the focus. These children have had some kind of traumatic experience or some kind of stress that has placed them with you. And what often happens is you don't do your own self-care. So if you're working with families, if you're working with grandparents or people that are providing kinship care, remind them to take care of themselves, because if they don't take care of themselves, they're going to have some problems. Let's just see. Yes, I was just looking at some of this. This is good information. Check the chat, folks. Yeah. Since I hadn't heard anything from you, I just wanted to know. I'm glad you're on board. What is self-care? Identifying your needs and actively taking steps. Meet your needs to protect your personal well-being. When you care for yourself, you're also better able to care for others. And here's some examples of self-care. I'm not going to go through all of it, but just remember, it's okay to say no, that you cannot do things, everything that you're asked to do. And if you have children added to that, what you're asked to do is even greater. Take care of yourself. Take time off without feeling guilty. Give yourself some space to grieve. You're probably grieving too. If you ended up with your role of taking over as the parent, you grieve your loss of being a grandparent. There's a difference, folks. I've moved from one to the other, back and forth. There's a difference. Sometimes it's nice to just be a grandparent. You grieve the loss of if someone overdosed or someone died. You grieve that. You may be grieving the change in your life. Maybe everything changed. We were old enough to have retired basically with a lot of the time that we spent with our granddaughters and great granddaughters. And luckily we were okay with that. But for some other people, that loss of freedom is gone. Go for a walk, go for a run, go to the doctor for regular checkups. Have the people that you're working with know it's okay to do that. It's okay. Take a break. Buy yourself something special if you can. Go to dinner. Go to another outing with a friend. Connect with others. And find a peer-to-peer caregiver support group near you if at all possible. Looking at the littles that you're taking care of, and the littles could be infants up through teenagers. Been there. I've done it through all of it. And every stage is different. Every stage is more of a challenge, not always a negative challenge, but a challenge. But it's important to understand that our young ones are in that care for a reason. And oftentimes their trauma, their mental health signs are there, and we need to take care of them. Oftentimes they feel guilt or shame after a traumatic event, especially if it's related to substance use disorder. We know that there's a bias and stigma attached to that. And luckily in our field, in our services, we're starting to address that. Our self-help groups, our self-recovery groups are starting to speak out more. They're sharing their stories rather than staying closed in, because stories can be a success. Those stories may help the next person start on a recovery journey. If children are acting depressed, anxious, or fearful, that's something to be watching for. If they're having nightmares, if they're having trouble concentrating on simple tasks, if they're at a point where they may be starting to use alcohol or other drugs, that's not uncommon, especially if they're in care due to substance use disorder. We know that not only is it environmental, but there's very definitely genetic predispositions for use. And it's not unusual for us to see that. If they're eating poorly or losing weight, gaining weight, it's a warning for you. Becoming involved in violence or other risky behavior, because that may have been what they've seen as they've moved out of the environment they were in into grandparent and kinship care. There's going to be some things that are pretty rough. Talking with the child about mental health can be pretty stressful, and it depends on their age, how you handle it. And the thing that's exciting about the circle of care is that a lot of the tools that are going to be used in there are the very things that we can use with these children. Because one of the things being addressed in that is not just overdose, but if children have been removed from the home, removed from their environment, there's a strong sense of grief. So these tools all fit together with what we're talking about. Try using some questions. Like, can you tell me more about what's happening? Have you had feelings like this in the past? Sometimes it helps to talk to an adult in your life when you're upset. I'm here to listen. How can I help? These are just some suggestions that were generated through two different sources that I had that were related to grandparenting. Would you like to talk about it? Offer to let them talk to somebody else, because oftentimes those children aren't going to feel safe talking to you. Once they get to be 6 or 7 years old, one good way to get your children to be talking is put them in a car. When you're going somewhere, just ask a casual question, and it can open up a huge door of issues or even little comments that you can build on that allows you to know what you need to do to help this child. Because if you're helping that child, it's also going to help you. I want to talk briefly about reunification, because it's such a goal when it comes to the role of children being removed and then working at getting them back in the family. With our granddaughters, that didn't happen. Although they did have a relationship with their mom, there was not a formal reunification, and we kept that guardianship till they were both 18. With our great granddaughter, that was a voluntary guardianship. Mom and dad knew that they couldn't take care of the children. They did not want to take a chance of their child going into the system, and ask my husband and I if we would be willing to take guardianship. So we upped the money, and we did. We took guardianship and never regretted it at all. But the wonderful thing that happened was one of the parents got their act together, got their life together, partnered with somebody else that's a wonderful parent, and was able to take that back. So looking at that reunification, sometimes I think we even made some mistakes and didn't really prepare the child enough, but it's another move for them. So as you need to help talk to them about it. There are indications when you're looking at reunification through the Department of Children and Family Services or other types of social services. Some parents just aren't ready for it. They may not show up for scheduled family time. I've done a lot of training with CASA, the court-appointed spatial advocates for children. And these are things that I heard over and over. I worked with the Family Treatment Court. Forgetting to attend an important event such as a medical appointment. Ignoring the child during family time when they were together. Reading emails or social media the whole time they're together. Having unreasonable expectations of the child. This parent's not ready to take that role back. That doesn't mean they won't be, but you have to pace it right. And oftentimes, very many of these things, if you come to the parenting and early recovery that I do, we talk about the fact that the brain's not ready to follow up on some of these things. And what are some of the tools you can give that parent to help them write down their appointments? Is there some way that they can get a call to remind them that they're supposed to show up at their child's medical appointment as part of this reunification plan? We know some children can be distressed after family time with their parents, and it can be due to a number of reasons. They may hear talk about them going back with the family, or the parent may be saying, oh, you're going to come back and live with me, really before it was time to do that. So there's confusion about that. They may feel guilty about leaving their caregiver at home. The person that's been taking care of them, oh, now I'm going to leave them, and they take such good care of me. They may be feeling guilty because they feel like they've caused separation. Oftentimes children are blamed by the using parent. If you just wouldn't make so much noise, I wouldn't use. If you did this, if you did that. That's part of the manipulation of someone that's experiencing substance use disorder. And children feel guilty. They carry that guilt. So here they're getting separated from the parent. Now they're going to get separated from the caregiver. They aren't sure if they've caused it. And they're not being old. They may not be old enough to understand it. And as a grandparent or caregiver, you can explain as best as you can what's happening. Got 2 minutes to do this, but I want to do this. There are some things that you can do to help that happen. Build a foundation that the parent can use when they assume their parenting role. Have a life bookbinder. Help the people that you may be working with that have kinship care as part of their life. Make sure there's papers such as birth certificate, social security card, health records, all those things. I had those. So when she went back to live with her dad and bonus mom, there was a notebook full of these dates and notes about psychological or developmental screenings, therapeutic plans, school records, contact numbers of what her experience had been. She was 5 at the time she went back. She'd been to Head Start, so all that was there. Records, pictures, including developmental milestones, activities in which your grandchild or kinship child participates. What do they like? Friends' names and contact information. What are their daily events? What's their schedule? What's their family time like? What observations are made during and after visits can be important where unification planning's concerned. All these things, it's giving the parents something to start from. It's not easy. The one thing I did to keep a linkage, and luckily we still see this grandchild, great-grandchild on a regular basis. She was here last night. She lives 10 miles from us. One of the things that I did though from day one is I had pictures of when she was little and growing up. And I'd send her an envelope addressed to her with some stickers and stuff in it and one picture every week. It kept her connected to us. She knew that we still cared. And it was a very good fit in helping that transition for her to make this new place her home, yet knowing she was still cared for and linked to us. And it made things better for the parents, and it's been appreciated. She spends at least twice a week. She's with her aunt or she's here, and we still have a good relationship, and she's 7. Here's some good resources, some things that I've put in here. You can we will send this to you so you can use this as a reference. These are just some really good things for you to look at. This is one of the best with Jerry Moe, Helping Children Understand. This is a great book if you're doing a reunification or things are getting pretty rough with the family. It's got great tools in it. Helping Children Understand that not all families look alike. And this is the one thing that I really believe: tell your story, shout it, write it, whisper it if you have to, but tell it. Some won't understand it, some will outright reject it, but many will thank you for it, because if we don't tell our stories, people don't know that there's success, that there's recovery, that families get better. And then the most magical thing happens when you share your story. One by one, voices will start whispering, "Me too." Your tribe will gather and you will never feel alone again. I love that, because even children, when they talk, when they meet, my 7-year-old granddaughter was just telling me yesterday about a person in her class that she wanted to give her outgrown clothes to, because she says she's got a really rough home. And I'm going, what do you know about a rough home? But I didn't say it. I just told her that that was really nice. But she's heard, probably from listening to comments, that it's important to let people know that there's me too's. I lived with my grandparents. Now I'm with my dad and bonus mom, and it's great. And somebody else can say me too, or know that that's something that might happen for them. So I thank you. We are at 2 o'clock, and I am going to sign out. There should be an evaluation pop up. I would appreciate it if you would please fill that out, and we will get your um, CEUs out to you. And I was just going to flip through here. Okay, there's a link that if you would fill it out, that would help. We just want to make double sure that we're getting everybody in here. And I thank you, and I hope you come back. We've got some really great ones coming on this year. So go to our website. Those links are all there for you to register. And I just thank everybody that's made comments. Goodbye.